Ozempic has certainly made the news recently, and it's changed the lives of many. I recently took Dr. Tina Moore's course on GLP1s, which is Ozempic. Her idea is to do it at extremely low doses, so microdosing these peptides for chronic disease, specifically metabolic syndrome. So let's take a little bit of a deeper dive into what is metabolic syndrome and why is it so detrimental. So, metabolic syndrome may be at the heart of many of your chronic degenerative diseases, everything from hypertension to cancer, PCOS. Almost everyone with PCOS does have some type of insulin sensitivity, non alcohol fatty liver, dementia, heart disease, insulin resistance, lipid problems, and type 2 diabetes. So, what is insulin resistance? In a healthy cell, when insulin binds, because we are sensitive to it, we want to be sensitive. We want to be able to hear insulin. So the pancreas produces insulin in a healthy cell that causes our GLUT4 receptor to come to the cell surface and open to allow glucose in. So now we can feed that cell. So that's what should be happening. Unfortunately, if we're in an insulin insensitive, so we're no longer hearing the insulin the pancreas makes, what happens is that GLUT4 receptor doesn't come to the surface and it doesn't open. Now glucose cannot get into the cell and we see glucose swimming around in our blood. And this can lead to a lot of disease. So think everything that can happen in diabetes, but you don't have to have diabetes to have insulin sensitivity. Insensitivity. In fact, if you've actually been diagnosed with diabetes, you've probably been swimming around in a sea of insulin insensitivity for up to 10 years, leading to a lot of big problems. In the brain, it can lead to dementia. And if we look at what's going on, ideally, again, glucose isn't going in. So we see that we produce less acetylcholine. And acetylcholine in certain parts of the brain is necessary to support our tau proteins, which are natural proteins to stop neurotangle fibers from happening. And it also increases inflammation in the brain. So can these peptides decrease neuroinflammation? Possibly, if done correctly and cycled in the correct way. How can you know if you might be working towards insulin sensitivity? Well, a quick and easy way to do it is actually through looking at your waist to hip ratio. So if you measure your waist and just about so two fingers just above your waist and then to your hips and divide them, the magic number you're kind of hoping for is around a zero point 0.7, so that hourglass shape. Studies have shown that it's not just a North American phenomenon to want this shape. When they looked around the world and they had men look at women, this was actually the shape they're going for. And it doesn't necessarily have to be the size 8. It might be the lady with a size 16, but it's a fertility thing. This is actually when you are the most fertile is when you have proportions this way, because when we have an increased size around the waist, we're actually less healthy. We're less likely to be able to conceive. So it's not about getting the Barbie doll figure. It's about being healthy. Let's talk insulin. It's about being as healthy as you can be. So I strongly encourage you to understand your hip waist ratio, understand insulin, and see what it might be doing for you.